have been a big part of my life for the last 2 years, part of my healing process from my oral cancer.
I was down, but now I'm up.
Dr. Peter Chen strives to make each root canal faster, better, and pain-free. Passionate about innovation, he stays ahead in pain management and endodontics to save natural teeth and ensure a stress-free experience for his Central Florida patients.
I was down, but now I'm up.
Welcome to the EG Dominates Dental Podcast. We are coming to you today from my favorite Lake Mary, Florida. I am here with Dr. Peter Chen from Advanced Endodontics. Thank you for being on the show. Really excited. We have some really cool stuff that we're going to talk about today. And you have been a big part of my life for the last 2 years and part of my healing process from my oral cancer. So I want to get in and kind of talk today not only about root canals and advanced endodontics, but also some of the things that you're doing to help out in the community. So thanks for being here.
Oh, thanks for coming over. I'm really excited. I've seen a lot of your podcasts, and it's great what you're doing. And I really enjoy your friendship over the years and your enthusiasm and your outlook on life. So
thank you. So you have something that's very rare that I really wanted the general population in Central Florida to hear and to learn a little more about. Because when you look at how many general dentists there are in Central Florida compared to the number of endodontists, there's a big disconnect as far as just the sheer volume of doctors. And you had told me a story a year ago about how you moved here and how you got started. You have 6 practices in Central Florida, 6 advanced endodontic practices. How many doctors do you have that work with you at these offices?
About 7.
7 doctors?
Yeah, 7 doctors.
And you're really conveniently located for just about anyone who lives in Central Florida if they need a root canal. You're really close. And some of the things that you've done in the last year or two to enhance that patient experience is also something that I want you to kind of share with everybody, because I think being an endodontist is one of those things where to the general public, you're kind of out of sight, out of mind.
Right.
But if you need a root canal, you're the most important person next to Jesus Christ in their life. And so I want you to kind of walk us through what you guys have created, because it's really special.
Okay.
So let's start off with this. Why don't we start off, tell us a little bit about where you're from.
Okay. I'm from Taiwan. I was born in Taiwan, and Taipei, Taiwan, and we immigrated over the United States when I was 10 years old.
Okay.
Yeah, and we first moved into New Jersey. It's where my mom's. It's actually my mom's sister that had the green card and the citizenship, and then just kind of migrated the whole family over.
Sister. Okay.
Right. At that time, they would want to come to America to get an education. I think the school system in Taiwan was really not that good. There's a lot of pressure, and so they thought that in America there's opportunities and stuff like that. So it was kind of funny how it worked out. So in my mind, it went one way, and then my parents' mind it just went the other. So when we first got here, this is the summer, I believe it's '83.
Okay.
And I love video games. Been playing video games since I was a little kid, and there were certain times in Taiwan, because kids were skipping school to play these, so video games were banned.
Oh, wow.
Yeah,
okay.
in Taiwan for some time. And so when we got to America, my brother and I have a younger brother, Jack. So my brother and I asked our uncle that, I said, hey, I heard in America, video games not banned, right? And he goes, no, we can actually get some right now. So that night, we went to the mall and got an Atari, like 2600 or something.
Yeah.
So my brother and I were up like 3 nights straight, just playing every
Pong.
game. Yeah. Space Invaders or whatever it is, right? We were here for about a month or 2. We were just going to places, Statue of Liberty, Niagara Falls, where no homework. Oh, man, I mean, we had to do a lot of homework in Taiwan, and, there's a lot of disciplines in class, So it's such a big difference, culture.
Man, America's pretty nice.
That's the thing, right? So toward the end of the summer, my memory was while we're playing video games, my parents like, hey, so do you like it here better than Taiwan? We're like, of course here better. Like we're, going to new places, playing video games and stuff. And he goes, well, if you like it, do you want to kind of stay here and, go to school? I'm like, oh, sure. Okay. And then they say, well, mommy and daddy have to go back to Taiwan and finish some business. You'll be living with your aunt, I'm like, okay, yeah, whatever. Okay, that's fine. And so my recollection is before I knew it, goes, okay, we'll see you later. And then they bought two tickets and went back. My brother, so my brother and I start, living with my mom's sister and Doris and Uncle Steve and in New Jersey. And then we did not speak a word of English. I didn't even know that there were 3 forms of alphabets, right? I only know the capital. I didn't know there was a lowercase or a script. So when the teacher wrote my name in script, I couldn't even read that. Wow. So the first day, the principal said, hey, these two need English name or American name. And so my uncle, I believe the story was my uncle, he was watching Three's Company, and so he likes Jack Tripper, so he goes, that one sounds like Jack. Okay, that's Jack, and that will be Peter. So that's how we got our name. And then it was made up at the principal's office at that spot, and boom, and I was Peter.
That was it?
Yeah, well, yeah.
Wow.
So we lived with our uncle for my parents came back and forth to kind of visit. And so while they're taking care of business in Taiwan, about 3 years. And after that, they realized that the kids, started missing their own, parents and stuff like that. Yeah. So they firmly moved over and we lived a year. I think the first 3 years we lived in Rutherford, which is about 5 minutes from the Giant Stadium in the Meadowlands. Yeah. And then, it was interesting. I entered 4th grade in America, not speaking a word of English. My math was amazing, but everything else was, you don't understand. And it's the second year, 5th grade, they started to teach French. And for an hour a day, Madame Saxon would come over and say, bonjour, mes amis, je m'appelle Madame Saxon, and it just goes on and on. And I was learning French for a year, and I thought it was British English. I didn't know any difference. Yeah. I was just memorizing words. And then it took a PTA meeting a year later for my aunt to tell me, oh, you've been learning French all this time.
And you had no idea.
I had no idea.
Yeah.
And we did a play, the Grand Café de Coca-Cola. I was the MC. I was just memorizing stuff,
So you had no idea what you were actually memorizing most of the time.
Right,
You're just learning words and speaking them.
Yes, exactly. I had an English as second language teacher.
Yeah.
That teaches the basics and stuff like that.
How long do you think it took you before you felt proficient?
About 3 years. About 3 years.
3 years, okay.
Yeah.
Which is pretty good, because you see people that lived here for, 15, 20 years that still struggle with learning the language.
Well, I really have my Uncle Steve to thank. I think he was, tasked with a responsibility, and he was a very old school kind of guy. And so he said, hey, you know what? Every day we're going to memorize, 20 words. Okay, these are 20 words, and you're going to memorize it, and you're going to need to be able to spell it for me and tell me what the meaning is. And then if you don't, I'm going to hit your hand with actually, see that little railing up there, the ceiling tile? There's a piece of that from the basement, and you go, I'm just going to, for every one, going to hit your hand. The left hand, because we're all righties, so the left hand, and you will write this word 100 times so you don't forget it. So I remember my brother and I used to go to the bathroom and rinse our hand in cold water, freezing water, so just try to numb it. So man, that was a little bit tough. And then after that, we got into reading books. So we would go to the library and you would pick out books and be like, okay, 4 pages today. And so when we come home, get out after school, we just memorize the pages and stuff and him the book before dinner. And then he'll just say, okay, go ahead. And then I would have to recite the words back to him. And you go, stop, what's that word? Spell that out. And then
so he was a really big part of your progression.
Yes.
Uncle Steve,
yeah.
Is he still in New Jersey?
Yeah, he had a big heart. No, he passed away, I believe, MS about 15 years ago. Yeah. He was a really interesting man, and he really did a lot for him and Uncle and Aunt Doris. He really did a lot for the family. The family was really, really big. I think generations back then, it was really about taking care of others, taking care of, right? You need help. Okay, we're related. You need help. Let me help you. So he's helped a lot of his siblings. I think a bunch of his siblings are from China.
Okay.
Yeah, I think a long time ago when they immigrated over to Taiwan, I believe some of the siblings were left in China. Those kind of the old stories. Yeah. So he was helping them, and so we really do owe a lot to Uncle Steve, and
that's cool.
Yeah.
So did you go to high school in New Jersey then? as well?
Yes.
Okay, so you progress all the way up. Now, do you have any family that are dentists or
No,
endodontists?
I'm the first one. I'm the first dentist. I'm the first doctor in the
family.
Chen family. Yeah.
So people usually love to hear that story, right?
Oh.
How did you decide that you wanted to become a dentist and then endodontist? What was your story like?
I think I was always very good with my hands, like do things and stuff like that and fix things. And I think back then my mom worked in a Israeli shipping company in the World Trade Center, so the Twin Tower.
Really?
So yeah, so my Aunt Doris worked there, my mom, and my aunt Amy, which is my mom's brother's wife. So the three of them work in the Twin Towers before. Yeah. So they would, I think they would leave at 6:30 in the morning, and then take a bus from New Jersey to World Trade Center to get there by 8:30, work till 4:30, and take the bus back every day. So they had benefits, and so my uncle was very keen on, hey, in America, everyone sees a dentist every 6 months, that kind of thing. So we were in the dental office all the time, and pretty soon it became a race between my brother and I who can get the least amount of cavity, because it was just, oh, Jack's got 2 or something, Pete's got 5. Like, oh, damn it. So what happened? So yeah, so going to the dentist was pretty regular, and so this is what happens. Asian kids tend to do what Asian parents want if they voice it enough, right? Okay. So then, back in my head, I always hear my dad, "Oh, you should be a dentist because they charge a lot of money." So that kind of thing. So that's kind of how it got an inception, right? Okay. So I kind of liked it, and I thought, hey, this is not I was very good at sciences anyway, math, so I was very good at sciences, and I was like, well, this is kind of cool. So
when you're thinking about this, you're in high school or you're in college?
High school.
Okay.
Yeah, so high school, and I talked to my dentist about it. I was like, oh, sure, and then he, I believe it was Dr. Gordon. He let me assist him when he was working on my dad, stuff like that. So it was like, oh, it's gonna be a bad idea, So as I went to college, I went to BU, Boston University, for college. I met a few friends. So when you're in college, everyone's saying, why do you want to be a dentist? You should be a doctor. There's, like, who want to work in people's mouth all day? You just need to be a doc. So I was impressionable. So I was like, you know what? Well, maybe. I really hadn't made up my mind about what. And I say, well, dentist is a thing, and then medicine stuff. So I started to, pre-med classes. Pre-dental and pre-med are pretty much the same. And we met a professor, Dr. Powers, that his son was an endodontist, and I didn't know, about endodontic at the time. And he kind of told us that, medicine's really not where it's at. You want to be in dentistry, and
so he's doing the opposite.
So he knows. He knows.
Yeah. Okay.
He has a hearing problem, so he reads lips. And my favorite memory of him was he teaches gross anatomy, is that we were studying and listening to him, and then he looked up and he saw these 2 girls. I guess they were mouthing, discussing what are we gonna do after class. He just calls them out.
No kidding, because he was that good at reading.
Yeah. He calls them out and goes, wait, hold on. I said, hey, what are you guys doing tonight? and if you're going to be discussing it, you need to leave my class. He told me that his son-in-law is an endodontist in New Hampshire, and it's like, you want to go there. I didn't know about root canals. I said, oh, okay. So, but he just told me that, hey, medicine's probably not what you think it's going to be. And I've been on medical school interviews and dental school interviews, and I realized that medicine, it's, they're kind of in a position where, well, we're up here, tell me why you deserve to be here. That kind of thing.
Like when you're interviewing?
Yeah, when you're interviewing, it's like, oh man, like what's going on here? And in dental schools, so I went to Tufts Dental School in Boston. Yeah. They're saying, hey, we're so happy that you're here. We know that you'll get in somewhere, but we want to make sure that this place is right for you. I mean, really? It is night and day.
Tufts is a fantastic school,
yes.
too. I've got a lot of dentists that I know and friends with that went to Tufts.
Yeah. Tufts is a very solid clinical school in Boston or in Massachusetts, yeah. So, yeah, they're saying, hey, it's just totally different mentality, right? One is, hey, you want to be one of us, you need to prove it. Mm-hmm. That kind of thing. And the other one is, hey, we're so happy that you choose our profession. Yeah. Like, come on in. And so they're very inclusive. So I thought, wow, what a big difference.
So you go to dental school, you graduate. Yeah. Did you know as soon as you were done with dental school that you wanted to become a specialist? Or did you practice dentistry before?
I went straight in.
Okay.
I went straight in. So, I've always worked. I always had jobs, like high school, college, and it was just kind of a drag, because it's balancing between work and then school and getting good grades and stuff. And sometimes I'm not the best test taker. And so it was same thing with school in college too. So when I got into dental school, I knew that I'm going to have a good job when I graduate. And so I wanted really to enjoy my dental school experience.
That's a great mindset.
So I did not work. I didn't, and I was very lucky. My other uncle came up to Boston, and 2 weeks before, my dad picked up a phone and said, "Hey, listen, your uncle got a job in Boston. Go find a 2-bedroom condo. He's moving in." I'm like, "Oh, okay," because I was already set to move in with my friends, and then so 2 weeks before, I'm like, I had to cancel all the plans, so we moved in together. He's my mom's younger brother. So
Okay.
My mom's side of the family, they're really tight,
Okay.
So, and he was never married, so he's always with us, and we live with him in New Jersey as well. So he came up, and so I said, you know what, I'll just, and I was getting loans, I was getting a little stipend, so living expense, and I didn't have to pay rent and, food, so, good for me, so I didn't have to work. And so I really enjoyed studying science for a change, because in college, you got to take a little bit of this, you got to take a little bit of that, right?
And you're studying to prepare for a test.
Right.
It's not like you're reading stuff, trying to really absorb it and learn it and to be passionate about it. You don't know, like, okay, I got to learn this because this is what the test is on.
Right. So it was, and I remember the first test we ever had was, I forgot what course it was. I mean, some kind of biochemistry. Like I got the highest score in the class, like the first time. I'm like, whoa, hey, I think I'm pretty good at this. But dental school is such a cool thing. Is not only we went to classes with some of our classes are with med schools people, and then we also have to do like pre-clin, which is you have to wax up teeth and do something 3-dimensional with your hands and stuff. So it's very, very different,
Mm-hmm.
But I love studying these things that are applicable to what I need. I love pathology. I think histology was one of my favorite, because you're studying biology, you're studying chemistry, you're studying all this kind of stuff, and you're like, okay, I can't see it, right? So the first time I can see something was gross anatomy.
Yes.
Right? You what does that do? Boom. Oh, it moves the finger. Oh, it moves this. So gross anatomy was interesting. And so histology, now things are making sense, right? So every part of the body, you have a respiratory system. Why does it have cilia? Oh, it needs to move stuff out. So clears your mucus. How does that cell differentiate from that? And now you see its structure.
You're learning about the cause and effect of each. Yep.
And where body parts are working. And man, that was fun. Pharmacology was great. I thought I was going to be, that was really helpful about drugs. And I hated organic chemistry, by the way. It was really hard, but pharmacology made it useful because I had to learn it for the purpose. So before I knew it, I was top 10. So I was like ranked 7 in the class. So like I didn't know it was that good. So because I was top 10, I was able to. I think my first year was like 4, and then like became like 5 and 7. You know, I was like, so by third year, I was still top 10 of the class, and when you're a top 10, you can pick a specialty. And so third year was when you get to decide like, hey, do you want a specialty or not? So up to this moment, I really wanted to be just a general dentist. I really didn't have any intentions of what. So then I started going to root canal classes and stuff like that. And I find root canals are very, I think the professors or the instructors are pretty laid back. Okay. So you'll show them, go, hey, this is a tooth. Okay, this is what I'm doing today. Okay, I think this is how long. Okay, great, go do it. Then you'll do it and go, okay, well, I got in. Here's a file. Here's another radiograph. Great, you know, and then you work on it, and then boom, okay, here's my cone, master cone shot, and then so all this time we have the time to do what we need versus like operative dentistry where you're drilling on a tooth and stuff. The guy's like, okay, I think you're, 0.2 degrees off to this side, and you should have an undercut here. And they're killing you all this stuff, you know? So I said, man, I kind of like root canals. And I like the fact that you have to diagnose problems. Somebody comes in, it's an ER, or it's just pain, and you just need to figure out what happened, right? You got to find out what happened, what caused it, and then can you fix it? And is it worth fixing? And what's the post-care? I really enjoyed that aspect of it. And I think it sounds kind of cliche, but very few branches of medicine, you can get people out of pain in an hour, right? You have an issue, you come in, fix your problem, yep. Right? Or surgeon's one of them, probably, right? So we either can take the nerve out, we can numb you, we can do things to alleviate your discomfort. And the diagnosis is, pretty straightforward. You have to be a little creative sometimes outside the box to try to get the answer. So to me, root canal was easier because I don't have to learn so many other things. And I found out that I'm very good at taking things apart. I'm not very good at putting things back together. Okay. So you know how some dentists are really good at waxing, their crown looks so natural and stuff? Yeah. I'm very boxy, like very linear. Okay. Like if you give me a picture to trace, I can trace it. But you say, hey, think of something and draw it. I can't. I feel like I have a tough time doing that. Yeah. And so I realized that if I was going to go out and do a filling to what I like, it would take me 45 minutes, an hour just to do it to what way I like it. And I would probably starve to death. So that's the other thing. You just never be happy. And then you have to like redo it, and then you're just never happy, and then I think I'm just gonna be able to sleep. And then with root canal, it kind of clicked. So I had a choice between root canal, endo, or ortho, or a surgeon. And then back then, at the time, you didn't really like to see all these gory things, with oral surgeons to see, and plus there was a little bit longer of schooling. So I just decided to take on the endo. It was a great decision.
That's awesome. So something that I think a lot of people don't know about you is that your next phase of schooling, you went to Harvard. Right. So here's a kid from Taiwan, right, who took a couple of years to learn English while he's playing Atari, right? And you come all this way. You graduate from Tufts. You decide, I want to be a specialist. I want to be an endodontist, and then you get into Harvard.
Yeah, I was very, very, very lucky. Very lucky. The funny story is my dad, for the life of him, cannot pronounce Tufts. Okay. It was like, what's your son go to school? Tough. No, Tufts. No, tough. Not Tufts. So I said, finally, I got a school you can pronounce.
And he nailed it.
Yeah, and so, I mean, obviously everyone's very excited. I was very excited. It wasn't something that it was like a dream school. I'm like, hey, I want to stay in Boston. There's three schools in Boston, so just kind of apply. Yeah.
So how many years have you been practicing endo?
I graduated 2001 in Tufts, and then 2004 from Harvard. So
2004, 20.
Yeah, 20. Yeah.
Wow. So over the last 20 years, what's been the most gratifying thing for you when it comes to helping and treating patients?
I think the fact that I can find ways for patients to save teeth. I know that there are times where a clinician would look at this tooth and say, well, is it worth my time? Is it worth the patient's time? Is it worth this, And sometimes they say, well, it's worth my time, but can I do it? My thinking is, if I can save it, I will try. And even if, if there's no profit or whatever, it's fine with me. Because at the end of the day, I need to perfect what I need to do, and the patient's willing to sit through it. They understand the risk and stuff. I'm willing to spend the time to see if we can make it work. And so
that right there, that mindset is shifted so much in the last 10 years.
Yeah.
To making it more about a business and getting people in and out fast. So to hear you say that is very humbling, because I know how scary and painful it is to be in that patient's shoes.
Right.
Especially when you go to the dentist and they say, yeah, I think you need a root canal. Unfortunately, I don't do it, so I'm going to refer you to advanced endodontics. I'm thinking to myself, like, oh my God, I got to go to a different doctor now? Like, you can't do this? So now I got to take more time out of work. I got to schedule another appointment with a doctor I've never met before so that they can do a root canal. And I've never had a root canal, so I'm nervous because I don't know what that process is like, right?
Oh, yeah. Yeah, it can be. Yes. Yeah.
So you nailed it, because you're taking the time to truly figure out, what can I do to save this tooth? And I want to be as good of a communicator as possible, because I want them to know what I'm thinking and what each step of this process is going to entail.
Right. Yeah, and,
believe it or not a lot of doctors do that, so.
Well, I think it's just the way that I would want other people to treat, me. I think, to me, that's part of the reason that we sign on to be in the medical profession, right? Like, we're here to try to take care of patients. I think most of our patients are really grateful, and then they're really fun to work with. I mean, sure, you get the occasional few and stuff like that, but we only remember the bad ones, and we don't remember the good. So I always have to tell myself, like, hey, for the most part, you're doing. Sometimes there are days where you're like, maybe next year, right? But you think about the stuff that you're doing. Are you thinking about the amount of people you're helping? And I think what's humbling to me is our staff, like our team members and our doctors and stuff. So when you look back and you say, hey, you're not alone, right? We started with 2 people and then just me, and then now there's probably 50 plus strong.
Yeah, that was kind of a good transition right to the next part that I wanted to talk to you about. Is not only are you a full-time endodontist, you're also a business owner, and you're not a single location business owner.
Oh, right.
You're a big-time business owner in Central Florida. You have 6 locations, and you have about 50.
50 plus. Yeah.
50 plus people that work with you guys. That's incredible. So you're basically doing, in a sense, 2 full-time jobs. You're running a big business, and you're also a full-time doctor. And I know how big of a culture, is for you and your business. Let's start with that piece, because I think that's kind of a good segue into talking about your staff and your doctors.
Okay.
Is that culture that you look for, because I know all your doctors and I know all your staff. And I feel like everyone has a really good, everyone gels together. Really nicely, right. They come together for one single purpose.
When, I think because of who I am, how I was raised, I think I'm a people pleaser. I think from a very young age, I wanted people to be happy and harmonious. Sometimes you need conflict in your life at times, but that's how I am. So I'm here to serve. That's kind of how I think myself. So I'm here to work. Sometimes it's hard to include others when you expand, to find the right mindsets and stuff like that. So it was hard. It was always an uphill battle to sort of trying to entice or encourage other people to do the thing that we do. As an immigrant that you're here, I think everyone's strategy in the beginning to compete for business is time, right? right? I'm gonna come in earlier than you, anyone. I'm gonna stay as later as I can. I remember like my record was 10:30 at night. So this guy, this was in Claremont, and I like looked at his chart, and he's from Daytona. I said, "What are you doing here?" And I said, "That's pretty far away." And he said, "You're the only guy in Central Florida that took my insurance that's open on Friday afternoons, and there's no way that I can make it through the weekend." And that was 8:30. He had like 2 or 3 teeth to do. I said, "All right, hang on." So, so back then I had a iPod and a headset. So he was watching movies while I was doing Canals. And by the time we went down, it was like 10:30. And I got a hint or two. My crew back then, I mean, there was just, they didn't,
Yeah.
they stayed, and some of them live in Sanford and stuff like that. We, went back to Sanford, and
Sure.
I lived in Altamont Springs back then. So in earlier days, I was very fortunate to have the support that I had to do what I need to do. And obviously, I have to mention, my wife as well, like, because I think that, she allows me to work on the business for the family and for the community, because if we're constantly getting arguments about why you're not home by 5, and like it would be a very different story.
Well, you love what you do, and I think when you love what you do, there's no time boundaries. Like I try to explain that to people. I love what I do, so I feel like, I'm working 24/7.
Right.
I do stuff on Saturdays. I do stuff on Sundays. And it's just because I genuinely enjoy the people that I work with, and I enjoy the things that I'm doing.
Right.
And so you're the same way. Like, you're always working. It's not like you're 8 to 5. You're on all the time.
Well, yeah. We have 24-hour emergency lines, so we man. But, I think it's not even that. To me, let's just say it's like 4:30, and I'm tired, but someone is saying, "Hey," crying, like, "I have this pain, and I don't know what to do," and you have something that you can do to help this person. So do you say, "Well, it's 4:30, better luck tomorrow," or do you say, "No problem, come on over"? And sometimes it's very hard to discuss that with some people, right? And sometimes, I'm sure we teammates have children, right? I mean, there's certain things and stuff like that. But that's the thing, is I know that at the home front, I'm okay. So there's an understanding there. But it's just, I don't have the heart to not even looking someone in the eye, but I have the heart to tell my staff to say, "Yeah, tell them better luck tomorrow." Like, call tomorrow or something, right? Yeah. Like,
you want to take care of them now.
You want to take care of them now, because you don't know what's going to happen tomorrow. Because this person can sometimes they go into shock. Sometimes they take a lot of medication that they shouldn't have, and sometimes they go to the ER, and then certain things that they don't know what to do with that. So it's just easier to take care on the spot versus dragging it out till Saturday.
So you heard that first. If you need an endodontist who will take care of it right now, Advanced Endo, they're going to make that happen. Well, it's a testament to you. You had just mentioned you have a back line, so you're 24 hours.
Well, we have an ER line that they call, and then so it's me and Allison and our communication director, and so we have it. We don't answer all the time, but it's a chat line that we'll see the calls. We'll kind of look at the messages and stuff. And I'm a night owl at times, and so she's so sometimes we'll see the message, but we'll definitely see it in the morning and stuff. So if they call or text or something like that, we try to get back with them.
Yeah, you're right on it.
Right.
Away. Well, so, that too, but also your location. So Lake Mary. Yeah. Where else?
Oh yeah, Port Orange,
okay.
Lake Mary. At 2 locations in Winter Park.
Okay.
Claremont, and Nona.
And Lake Nona.
Yeah.
So, yeah, I mean, like, you're literally, if you live in Central Florida, you are pretty much always within 20, 30 minutes of an Advanced Endo.
Yeah, we just happen to circle the Orlando area.
Oh, smart.
Yeah. So usually on Saturdays, we open in Lake Mary. It's just because I live across the street now, so it's just easier for me to just come in and take care of something.
Sure.
Yeah, if we need to. Yeah, and, it's funny thing is, when I travel, especially in Asia, I actually will answer the 2 a.m. phone call, because it's 2 o'clock in the afternoon.
Yeah.
And so they're like, "You're up?" I'm like, "Hey, how's it going?"
You're like, this doctor answered his phone at 2 o'clock in the morning. This guy's on it.
What's happening here? Don't worry, we'll take care of you.
Yeah.
And so, I mean, we try answering surveys and stuff like this. Still, that they'll take. We're working on chatbots. So now we're trying to work on chatbots to kind of figure out how to sort of triage you, right? If you're in pain, that's one thing. If you're like temporary feeling fallout, okay, we'll guide you to something else. Or we're working on certain technologies that will kind of enable us to kind of service things better. So
from a communication standpoint, you're able to not only respond quicker,
right,
but you're able to show a more personalized touch by making it more customized to each person's individual needs.
Right.
Which kind of leads me to the next point. So I met you about 2 years ago. Mm-hmm. And for the longest time, I love telling this story, you were like the Wizard of Oz. Right? I'd heard of you. I think I had stopped by your offices, no joke, close to 50 times because I wanted to schedule a meeting with you.
Yeah.
But you have so many locations. I didn't know what locations you worked out of. The staff did a really good job of not letting me know where you work out of. So
I think
kudos on that. But once I finally met you, the whole time too, you're going 6-8 months trying to meet somebody, and I'm like, what's this guy's deal?
Yeah.
He must be a total jerk. How do they not know that I've come by here? Rough stuff. It's me, right? It's EG dominates, right? And then once I finally met you, I was like, damn, Dr. Chen is incredible. Like, I love this guy. And then you went to a course in Nashville.
Right.
And that's when you and I really started talking about patient experience.
Right.
Because that's been my mantra from the start. I know in my heart that if an office or a doctor can create a very comfortable, very personalized patient experience, number one, you have a patient for life. Mm-hmm. Number two, your referrals are going to increase because people are going to proactively say, oh my God, if you ever need a root canal, you got to go to advanced endodontics.
Right.
These guys, I called the office's emergency line at 2 o'clock in the morning, and Dr. Chen, he didn't answer the phone all the time. But it's that customization.
Right.
And then we start talking about how can we utilize technology to enhance that patient experience. So let's talk about that, because you have 6 locations,
right?
And in each one of your locations, you have the same technology. And it's not just one thing. You got several different things.
Right.
So once we talk about that, I think that's important for referring doctors to understand what type of technology you're utilizing and how that helps the patient. But number two, if you're a general person right now, you come across this episode and you're watching this, if you get or need a root canal, especially for the first time, I think it's important to know what your options are.
Right.
So kind of touch upon that.
So the our mantra with our office is, hey, look, they're gonna be here for an hour. It's a 1-hour show. So so let's just make it as painless, as exciting, as comfortable as they can. Now, it is hard to. I think if I only have 1 or 2 offices, it's easier to maintain. It's harder when you're at 6 because then now everyone's, hey, you're doing all that. So usually, we have a lot of technology things because I feel like technology, we need to incorporate technology into our work because they just make our life easier. And at the same time, we don't want to remind patients all the time that they're in a dental office. So this is why our office, most of our office that we built are not meant to look like a dental office. More kind of a hotel or cafe kind of a setting vibe, right? Mm-hmm. And so when they come into the room, we try everything. I think numbing was number 1 was our first, right? I hate coming to the dentist because I just hate the needle, right? So we have special compound topical to I tried it one time. I was numb for an hour.
Yes, this stuff works incredible.
That thing is amazing.
Yeah.
And then we use something called the Dental Vibe, which is a vibration device. It's a retractor. It's also a vibration device. Sometimes it's a little harder on the interior, but when you do buccal injections, some patients don't even know that I'm giving them an injection. Yeah. And so that's one out. Nitrous, trying to make everyone relaxed. Now all our offices have these goggles, the VR goggles. They can plug in their iPhone and they can watch TV or whatever on their phone in there. I used to hang iPods off of microscopes so they can see it because I just want to distract them. I don't want them to know what the heck is going on.
Yeah.
I want to go in, I want to go out and go, oh, this is it. So one time, I was doing a lot of teeth, like 2 teeth or something. It was a retreat, and this guy sat through the whole Avatar and that movie, and I thought, man, you were here for a long time. I said, this is my record. I don't think anybody's ever sat in my chair for that long. But we have goggles and stuff like that,
Yeah.
so they can watch a movie, just try and do everything. Those are kind of the technology. Obviously 3D. We're trying to see what we're getting into. Sometimes, I think there's a lot of miscommunication about cone beam, CBCT, because they're saying, well, it's an extra radiation. Is this? Well, there is some radiation involved, but I think the benefit outweighs the risk. And the reason we find is that when we take a CBCT ahead of time, and you're looking at the entire tooth structure on your jaw, a lot of times I can pick up different things for you, not rather than just this tooth. And also sometimes we can distinguish whether or not we should treat the tooth or do surgery or extract a tooth. But if all we have is just a two-dimensional radiograph that's been around for 50 years, we're just kind of guessing like, oh, okay, it needs some work done, right? So it's almost like you get the work done, and then 3 months it's not healing. Okay, let's take it. Oh wow, I didn't think the thing was that big, and now you're gonna need this. Versus now we say, okay, this is what we're gonna need, or hey, it's too far gone. Maybe it's not worth saving. So I think now we try to encourage our patients that let's take the CBCT first. Let me map out what I need to do, and give some directions sometimes to the referring dentist, like, hey, that could be a problem in the future. Hey, this one is going to be, we're going to watch that one for now. This is our main problem, and stuff like that, especially with resorptions these days. Yeah, when the tooth start to resorb. So CBCT is one of them. And I think now it should be a standard, pretty standard among root canal specialist offices, Yeah. So it was, I think 2019 is when I got into dental lasers. So 2019, I was got into dental lasers, and it was one of the doctors that was holistic dentist, and he said, hey, I've been sending my patient to Tallahassee, and so if you learn this technique, maybe I'll send some to you. So I looked into the laser, and this lady Denise. So Denise was very gracious, amazing person. Came to the office. Goes, okay, I'll bring it over. I'm like, oh, okay. So most of the time, laser company do not bring their stuff over, but she brought her unit over, and it's the Photona light walker. She brought it over, and she stayed with me for a whole day, and I was treating cases and stuff, and I see one of the tough retreats that is like really, really dirty because it's a lot of bacteria has invaded the dental tubules. And normally I would have to sort of use a round burr to drill out the cavities and stuff, the caries, and the stain. But when I was using this, by the time I was done, it was kind of bleach white, So, wow, that's a clean, because sometimes we clean as much as we can and we leave that stuff there because you don't want to drill too much and might weaken the tooth structure. And we say, well, let's see how it goes. And this time you could visibly see how clean it was. And so it kind of struck my mind, and I said, I gotta have this. Well, first of all, I said it's gonna cost a lot, and I said I gotta have this but it's gonna help me do things better.
Sure.
And I don't have to face to talk to, right? Let's say if another dentist has it or something like that, and then I don't have to face it. I'm like, well, I do a better root canal. I'm like, I know that this is gonna be better.
Yes.
So fine. But by the bullet, bought the laser. And the laser has two other functions that I didn't know of, so we'll kind of go into that. So after that, COVID came, and then we're doing all this stuff, and then that met you, and then we talked about GenOwave. So that's kind of got into the GenOwave, and the same thing with GenOwave is I love the company's mantra of working together, helping, creating a better environment for the patients and stuff like that. or patient experience, and I see what it does. So I see another technology that I don't think I want to live without. I could probably live without it, but I don't want to.
Sure.
Because there are things that I know that I have physical limitations to the anatomical anomalies, and it cleans better. And I think for the first time, there's the laser and general wave. They can bring all the doctors level higher and
Yes.
closer, right? Like,
Exactly.
like you have somebody that graduated a year or two ago versus someone's working here for 10 or 15 or 8 years. You can kind of bring them up a little bit. So,
Sure.
with 6 locations, you don't want to create, that one's better. Go to that location is better. Go to this guy is better. So I want to be able to let everyone
Consistent patient
consistency.
care.
Right,
Mhm.
right. So now we have we're probably the I think one of the few offices that have both the laser and the general wave, and that we can pick which one to do. And the reason we started doing these kind of treatment as well is that we realized that after 10 or 15 years of doing this, when we start to core out the tooth a little larger, teeth start to break now because people are clenching more.
Yeah.
They're just having more issues. So now the I don't want to say the fad, but the way we're thinking about this, we're trying to minimize instrument the canals first and using assisted irrigation to clean out better. And that way we're hoping that the tooth that had a root canal can last longer.
Sure.
Yeah.
So if you're a patient and you need a root canal, I guess to sum it all up, is that you have a location that's conveniently located everywhere in Central Florida. You got 6 of them. And then on top of that, if you need a root canal, it's not like you're coming to an office to get a traditional root canal. You have 3 different options in a
Right.
sense. Traditional,
Right.
laser,
Mm-hmm.
general wave.
Mm-hmm.
So now you're offering multiple choices a lot of times for these patients.
Right.
Because patients are smart and they do research on the back end. And so some of them are researching the laser, some are researching general wave. And so they kind of sometimes come in with a preconceived notion in their mind of what the experience is going to entail, right? And so you're able now to say, look, it doesn't matter how you want it done.
Right.
We have great doctors, we have great staff, beautiful locations, and we're going to set you up for success so that hopefully we're able to heal this quickly and not have any issues in the future. How do you want it done?
Right.
Right?
Yeah, that's it. That's it in a nutshell. Yeah. One of the other things that I think make our office unique is that we do a lot of surgeries.
Okay.
So apicoectomies and stuff. A lot of times when offices that don't do these services. So apicoectomy is we clean everything to. Sometimes there's certain areas in the root tip that we can't get to, or sometimes there is a cyst that grows a lot, very large, and a lot of times people would look at these teeth and say, look, it can't be saved, let's extract it. So in the beginning it was tough to get started, so we've been doing surgeries on these teeth, and now we have a pretty good track record. So now, unless the tooth is vertically fractured and you have really deep pockets and stuff, we can pretty much save teeth and extend their life. Yeah. So, and there are some other, and I think endodontists are the ones that should be doing the root canals, the apicoectomies. I think because with the microscope, because the microscope kind of let us see a little bit better, knows exactly the minutiae of what we need to do. It's so it is really a very technique sensitive surgery.
Yeah.
I know that there are a few oral surgeons that are pretty good at it too. But I think with apicos, having the microscope, being able to kind of look down the scope and see what you're doing is really, really monumental.
That's awesome.
Yeah.
So, shortly after I got diagnosed with oral cancer, you and I talked, and this was leading up to the surgery. And I remember talking to you and how excited you were, because when we got off the phone, I told my wife, Ashley, I said, man, Dr. Chen was really, really excited about this conversation. And she said, what did he say? And I said, well, do you remember last year when I hurt my knee and he used red light therapy on it? And she goes, yeah. I said, well, I'm learning more and more about red light therapy, and Dr. Chen has a red light therapy machine that he uses outside of his normal endo clinic. And he was telling me that he thinks that it will be able to really help the healing process from my surgery. And I think it was about 2 weeks after my surgery, you came over and you brought the red light therapy machine. And I wanted people to kind of hear from you the different things that you're doing with the red light therapy machine. I can attest to my own personal experience of, and we're going to put the photos up so that you can see my before and afters. But in 7 to 10 days, we were able to close a hole that had formed in my chin from a suture that popped.
Yeah.
And the hole was from the inside of my mouth to the outside of my mouth. And it was oozing the leftover remnants of the graft that they used to build granulation tissue inside my mouth. And I remember sending you a photo and talking about it. And my cancer surgeon told me he thinks we're going to have to go back to the OR and do surgery to close this hole. And I mean, after I've been through a 10-hour surgery and everything else, like that's the last thing that I want to do. And I just happened to see him the day after you and I spoke. And I told him, hey, I have a friend who's an endodontist. He also is really big into red light therapy. He's using it for a lot of different things. I'd like to try the red light therapy on my chin to close this hole before we do any surgery. And he goes, okay, let's do it.
Cool.
And I had no idea if it was going to work. I had no idea what the time frame was going to be for it to heal. But he came over, explained how to use it, and in 7 to 10 days, it completely closed the hole.
Wow, that's incredible.
And I know I sent you the photos, and you've seen it.
Yeah.
And we're going to put the photos up so that everyone watching this can see it as well. It absolutely changed my trajectory of healing. In my whole experience of how easy it was to use it and how it helped to alleviate pain and to heal. So I want you to kind of talk about what your experience has been with this machine and how you're using it right now.
Okay.
So the machine that I was using, just so everyone has an idea, so this one right here is the lollipop, and the lollipop goes into the mouth.
Yeah.
So this actually goes into your mouth. And I was using this for 2 minutes a day. Okay. The other one, do we call this, is this the hammer of Thor? Is that what this one is?
You know what? I don't know what it's called, but it's just it's a regular LED. Yeah. So it's size of a palm. Okay. It's got a red light and near infrared. So this machine is called is from Thor Laser. Thorlaser.com, and they're a group in England, in London. And so how I got into red light therapy was that the Photona laser has 2 wavelengths. One is at erbium and the other one is indiag. And they told me, oh, you're going to do really cool things with laser, but it has another function called photobiomodulation, or PBM. And then I figured out, oh, okay, so what else does it do? Well, it's we call that the magic wand. I'm like, okay, so what does it do? So it turns out that it creates a wavelength. It's an infrared wavelength, I think about 1060 or 1064 nanometers of wavelength.
So this is not the Timu
red
light therapy. Like this is
no.
Yes.
Yeah. So you can kind of tell how good of a machine is by how much it costs and how long it takes.
Yep.
Okay. So most good machines takes a minute. Okay. If they tell you healing takes a minute, 35 seconds or a minute, that means that the energy is strong. If they say, hey, it takes 20 minutes, and it's $200, that it's okay. I think industry standards probably around that. So I kind of dive into the rabbit hole of what photobiomodulation was, and it turns out that this thing has been around for ages. And what it's good for is to close wounds. And back then, because these red lights were generated using laser diode, they were concerned of whether or not it would cause cancer. So they started doing cancer research on side effects of this stuff. So I believe one of them was shaved rats, right? So maybe it's a rat that can create cancer like real easily, and so they shave the skin, the fur out, and then they would shine a red light. So a control with no light and one control with light, and they did a bunch of these studies. They realized that doesn't increase a chance of cancer, so it doesn't create cancer. But the rats that had the light shine on, their hair grew back faster. So they're like, huh? Like what's going on in here? So I don't know if you guys remember, but the first red light therapy products you've ever seen in your life is what? Hair growing cap, right? And a comb, right?
Yeah.
So that was how long? 15 years ago, right? So there's a lot of stuff, right, going on. And so these things are pretty expensive because the red light therapy machine on the Photona laser is a class 4 laser. So a lot of people cannot use it. You have to probably be in a doctor's degree or I think a dentist, I think plastic surgeons and dermatology or something like that, they can use it. So regular people cannot use it because if you shine the laser direct in the retina, because it likes to attach to pigments, so you can go blind.
Yeah.
So right, remember they tell you like the laser pointer, don't shine into the eye.
Yeah.
Similar concept. So about 10 years ago is when the LEDs got into it, and they were very good at making these wavelength. So our bodies emit infrared, so near infrared and infrared. So we are tuned to wavelength of red light, which is about 650, and then 810. So 650 is probably the red light, and then the near infrared's around 810, 850, and then there's about 950 or 960, and then 1060 is the infrared, which we can't see. So they found out what red light does really well is it gets rid of our cells' oxidative stress. So it flushes out the nitrous oxide in the cytochrome oxidase C of the mitochondria.
Okay.
That area is responsible to making ATP. So it flushes it out. It completes the electron transport chain. So now your body's going back. So basically, it tells disease cells or cells, hey, let's get back to work. Yeah. So you start making ATP, which is the energy of your body, and then that nitrous oxide will come out, will do vasodilation, which means that it will dilate your blood vessels. So now you have more perfusion of blood into your local sites to flush out toxins or bring more cells to it. And it also has secondary functions to create more collagen. That's why now you see red light face mask. So that's that's one thing that does really well, is that's all it does. That's why, but because it does that thing really well, you have so many other applications of it, like arthritis, and so there's two functions that it does. If you shine it enough to give it an active dose, it will promote healing. If you shine it too much, you overdose it, it actually will decrease pain. So it will temporarily cut off nerve conduction for a little bit, about 24 hours. Yeah. So
I experienced it firsthand. I mean, to hear you talk about what this red light therapy does compared to what I went through and experienced using it was spot on. So to kind of recap, using the red light therapy on myself, the fact that, and again, I'm only one person speaking from just my experience, but to be able to close that hole in 7 to 10 days is unheard of. And just a blessing to know you, and the fact that you're doing all of these things outside of, being an endodontist and running an endodontic business. How many years have you been using the red light therapy for?
Well, since 2019. So I think end of 2020 is when we really got into it, because we had COVID, and then the training was, we didn't know how good this machine was, and then so end of 2020. So about 3-4 years.
Dr. Chen, what are some other areas that you're using the red light therapy? So arthritis, healing from wounds.
Right. I think the biggest thing and the most underrated is oral mucositis. So this machine is actually built for oral mucositis. So oral mucositis is a condition where if you have head and neck cancer treatment like radiation or chemo, your mouth would have sores that develop, and you have a lot of pain. Sometimes you'll lose your salivary glands and stuff like that. So, and it becomes so painful at times where the patient can't eat, can't swallow, and they would have to give up. There's really no treatment besides palliative treatment, right? So like maybe some numbing gels and stuff like painkillers. And so most oftentimes patient would have to stop the radiation or chemo treatment, and then they may not survive. So I think that's the reason. And so the red light was found to be able to counteract that. So when you have red light therapy session in conjunction with your chemo or radiation treatment, you really have minimal discomfort, and you can minimize the oral mucositis. And so it's a I think it's really a miracle, and at the same time, it actually really helps trying to retain as much salivary gland as possible, because everyone cares about what happens now, but after the treatment is when you're having issues with your teeth, right? You have dry mouth, you have cervical caries, you're gonna lose all your teeth because of this. It doesn't matter what kind of stuff restoration we do for you, it doesn't work. So using red light actually can create salivary gland flow if there's still some around, or we're trying to prolong the life of it. So to me, I realized that what I had in my hand, but I couldn't get it out there, because I would talk to physicians, and so they didn't quite understand, or they would say there's not too much research out there. I think there's plenty of research if you are willing to see it. And it's been proven to not cause cancer. It's been proven to not damage, anything. There's no very few indications. They don't shine directly into a pregnant woman's belly. That's probably one of them. Wear eye protection. That's about it, So the worst thing that can happen is it doesn't work, and there's no side effects. Yes, yeah. You're not taking any pills. You're not taking. The only thing
you're out is time.
Time.
That's it.
Yes, spend time. Yeah.
So if I'm somebody like myself that is going through cancer, oral cancer, and I'm watching this and I see it, how do I get in touch with you to learn more about red light therapy or this machine specifically? I know you do a clinic and you're doing some other things.
Right.
Why don't we talk about that for a second?
Okay.
Because I want anyone that's seeing this, it doesn't matter if you're a family member or somebody that's going through something like this or something similar to where you would benefit from red light therapy. How do we connect the dots so that they can get to you? Okay.
You can always reach me at peter.chen@ineedarootcanal.com. So that's my email, and then we'll just call the office, and you can have access to my cell phone number.
Sure.
I'll be more than happy to share the information. So because I realized that this is such a good thing for the public, we started to create another service. So my wife and I kind of discussed it, and it's, as we get older, we have dentists have a lot of neck aches and pain stuff, and it's because we don't stretch enough, and our muscles are getting weaker. And so we created a wellness center called Pato Wellness Center. It should be open. It's not open yet. We're planning to open by the end of the month or next month. We're just trying to get
What's the name of it?
Pado, P-A-D-O,
P-A-D-O.
Pado
Okay.
Wellness Center.
And where's it at?
It's located in Lake Mary, next to our AE office in Lake Mary. So inside here, we have collaborated with a physical therapist, Dr. Stephen Baylaw from B Physical Therapy, his group. So we have a physical therapist and also a medical massage therapist that's really into trying to help you get back so that you can have a better career, have better flexibility, a better life. And then we're going to try to include the red light therapy into it because red light therapy actually has other uses such as decreasing aches and pains, it help you heal. So another cool example would be someone that had a diabetic sore, like a non-healing sore on your toe or something like that, or bed sores. Red light can help with that healing because what it does is it tells the cells around there to start making energy, and it opens up the lymphatic channels and the blood vessels to bring more perfusion down there. Yes. Yeah, and that's what we need, and that's why this is it works so well, and it's indiscriminate. I think the tough ones I see. Oh, there's a really cool research that they did was they had rats that have that can create myocardial infarctions, heart attacks. So when they induce heart attacks on 2 rats, and the rat with the light shine on it only has 25% of the damage as the one without it.
Wow.
And the reason that it doesn't work with us because our chest cavity is too thick. They can't penetrate it.
Okay.
Yeah. So that's, I think, it'll be interesting to see what happens. So I think they try to sort of beat around the system by shining the light on the sternum and then your tibia, because those are the thinnest part of your body, and they can create stem cells to try to get to the area for healing. So they're working on that. There's another one. Anytime you have surgery, it's in a certain area, it's better to shine the light ahead of the day before and then start doing the day after, and it will increase your healing rate. Yeah.
Yeah, you told me that.
Yeah. So there are just really cool things about red light. That sometimes I feel like it's pharmaceutical companies that they don't want to develop it because they want everyone to pop Tylenol, pop an Advil whenever they have an issue. Yeah. So my goal really is to use natural, I would say natural, but like holistic approach and try to bring some to make the older population live better.
Sure.
Because it's really tough to see an elderly, well, it doesn't have to be the elderly, someone that's injured and, they can't do, and then just to kind of sit there and they're struggling. And usually these people you don't hear from them, So I think the goal for me is I know the root canal I love root canals. I know root canal is cool. But I think with Wellness Center, we can help more people, in a better way. Yeah.
So that's kind of your passion project
Yeah.
right now.
It is.
It's fantastic.
Yeah.
So you got the Wellness Center that's going to be opening in Lake Mary really soon. Pado?
Pado Wellness Center.
Okay.
Yeah.
That's awesome. Well, I got one last question for you,
Yeah.
because I really appreciate the amount of time that you've taken today to share your journey of who you are and what you do. Where do you see yourself in, say, 10 years from now? And what do you want your legacy to be when it's all said and done?
I think I want to be an educator. So I've always liked teaching, and I've always I like to solve problems, and I like to find ways to teach. So I think I see myself in 10 years. I'm going to probably still practice maybe a day a week, and kind of making the stage, the platform for the next generation. Like, how can we find a way to store knowledge and expertise and experience and pass it on so that it's easier for people to learn. And I think that would be a tremendous respect for the people that have taught me along the way. you know, because I think when we do this, everyone wins. I win, you know, the clinicians win, the patients win. And it used to be a win-win, but I think it needs to be a win-win-win. And I think that's how we can bring everyone together and work together. Because if you look at these specialties and other places, everyone have their own thing and they don't talk to each other. And I want to find a way to bring people together and, you know, check our ego at the door and said, okay, how do we get this patient better? You know, so they have more freedom on a better quality. I think better quality of life is very important to me. Yeah.
Awesome. Well, thank you so much for being on the podcast today.
Well, thank you for having me.
You're an inspiration. You're a friend, and I'm glad that you had the chance for people to learn a little bit more about you and Advanced Endo and the Wellness Center.
Oh, thank you. Thank you so much.
I'm a believer. I'm a believer for sure. Thank you for being on the show.
Oh, thank you. Thank you.
I was down, but now I'm up. Yeah, this all God, this ain't no